Today, I'm Jasmine Cortez. So today, I'm going to perform a bed bath return demonstration. Bed bath means to wash someone in bed, and it is important because it cleans the skin and help the skin be free from infection and help the patient to feel better. So now I'm going to verify the patient first. So good morning, ma'am. I'm Jasmine Cortez, your student nurse for today. So today I'm going to assess you with your bed bath to help you feel fresh and improve your circulation and ensure your comfort. So now may I see your wristband po, and please state your name and your birthday.
I am Princess Izzy Agagsilla, May 27, 2005.
Thank you po. Okay. So now I'm going to perform hand hygiene first. So next is I'm going to wear sterile gloves to maintain sterility. Now my hands is both sterile. So next is I'm going to provide privacy to ensure that my patient is comfortable. So now I'm going to ask my patient first if she want to use bedpan or urinal. Ma'am, if you want to use bedpan or urinal, okay. This is the materials that I will be needing.
Basin or sink with warm water, towel, basin with soap, hamper, soap, tissue, clean gloves, and lastly the linens. So in clinical setting, I have to raise in comfortable working height and lower down the side rails at my side to promote good body mechanics and ensure the safety of our patient. After doing that, I'm going to assess my patient to move closer at my side. So ma'am, I need you to move a little bit. So now I'm going to place a bath blanket over the patient. So ma'am, can you hold me for this please? And now I'm going to remove a soiled top sheet. So this is to ensure warmth, privacy, and comfort to the patient. And I'm going to place this on the hamper. So now I'm going to remove the patient's gown. So if the patient has an intravenous line, injury or disease, mobility begin at the unaffected side. Now that I removed the patient gown, I have here a basin with warm water that's about 2/3 full and it is 43 to 46 degrees Celsius. First, I'm going to let my patient check the temperature if it is tolerable for her. So ma'am, I need you to stick your hand into the basin and tell me if it's too hot or too cold for you, okay? Now I'm going to remove the pillow under the patient's head. Now for washing up the face, the first thing that I'm going to do is to place the bath towels appropriately. So the first bath towel should be placed under the patient's head. Now for the second bath towel should be placed over the patient's chest. Ma'am, may I know if you're wearing contact lens? Thank you po. So now I'm going to wash your eyes first. So for washing the patient eyes, the first thing we're going to do is to soak the washcloth into the water. So I'm gonna soak it into water and rinse it thoroughly. And then we're going to fold it to create a bath mitt. So this is to retain the heat and water and prevent dragging the washcloth into the skin. So now I'm going to start from inner canthus towards the outer canthus using the separate section of the washcloth for each eye. So this is to prevent the transmission of microorganisms from one eye to another. So now we're going to proceed in washing her forehead, cheeks, ears, nose, and neck. So ma'am, would you like the soap to be used in your face? So now I'm going to start in her forehead, and then cheeks, and then nose, ears, and then neck, or S method. And dry the face. Now for washing the patient arm and hands, the first thing we're going to do is to expose the forearm of the patient and place the bath towel lengthwise underneath the patient arm. So now I'm going to start washing the patient arm first using a long firm stroke. And then I'm going to proceed to her hand and fingernails. And dry the arm. And then I'm going to let my patient to place her right arm over her head and lightly support it. I'm going to start washing her axillary and dry it. After that, I'm going to proceed on the other side. Do the same procedure. So now I'm going to proceed in washing the patient chest and abdomen by placing the bath towel across the patient chest while lowering the bath blanket towards her umbilical area. Okay, and now I'm going to leave the bath towel and I'm going to start washing her chest using long perm stroke. And I'm going to dry her chest. Now always remember to pay attention to the skin under the breast, especially in females, or any skin fold areas, particularly if the patient is overweight. Because as we all know that skin fold areas are prone to sweating or perspiration. Therefore, bacteria will drive us into those moist areas. So now I'm going to proceed in washing of the patient abdomen by placing another bath towel in her abdomen. And then I'm going to lower down the bath blanket towards her pubic area. Then I'm going to start washing this abdomen using a long perm strokes. Okay, now I'm done with her chest and abdomen. I'm going to proceed now to her lower extremities. Now for the patient legs, I'm going to do is to expose the patient leg by folding blanket toward the midline, keeping the perineum covered. Now I'm going to place the bath towel lengthwise underneath the patient leg. Now I'm going to start washing the patient leg using a long perm stroke, starting from the ankle towards the knee and then feet towards the leg. And dry it. So now I'm going to proceed in washing her foot toes and toenails. And dry it. Now I'm going to put some moisturizing lotion to moisturize the foot of my patient. After that, I'm going to proceed to the other side and repeat the whole procedure. Now always remember that in soaking the patient feet for about 10 minutes would help maintain the cleanliness of the feet and toenails. But you must also remember must avoid soaking the patient feet with diabetes or impaired sensation because it may cause harm or injury. Now that I'm done with my patient anterior side of the body, I'm going to discard the washcloth and maintain the patient privacy. Refill the basin with clean water and change a clean pair of gloves and apply perineal care as necessary. So now with a newly refilled basin washcloth and clean pairs gloves, now I'm going to perform perineal care to the patient. And assist the patient into the dorsal recumbent position. And start the perineal care. So I am done with the perineal care. Next, I'm now going to proceed at the back of the patient. So I have done a new set of gloves and I refilled my wash basin with warm water. And now I'm going to assist my patient to a ground side lying position so that I can clean her back. Okay, now I'm going to place the bath towel alongside at the back of my basin and her buttocks. Now I'm going to start washing the back of my patient, starting from her shoulder towards her buttocks and upper thighs while keeping special attention to the global pores. and dry it. Okay, now I'm done batting the patient now. And roll back the patient. Now I'm going to help my patient wear her new clean gown, and I'm going to check the devices attached to the patient. So ma'am, this is your new clean gown and I'm going to help you wear it, okay? Okay ma'am, we're now done with your bath. How was your feeling? Good to hear. I leave you to rest now. Just press the button if you need anything, okay? Thank you ma'am. So now after the procedure, I'm now going to perform the aftercare of the equipment that I have used to maintain sterility and cleanliness of those equipments. So now that I'm done, I'm now going to perform hand hygiene to prevent the spread of microorganisms. After that, I'm going to document the procedure that I have done. So that's it for my return demonstration.